While being in the health science program throughout my high school years and working my way up to be accepted into the nursing program during my final year of high school, I learned many common procedures done in the healthcare field. One of the most important things that I learned was how to take blood pressure manually. For most people who want a career in the medical field or do something in the medical field, more than likely they are expected to know how to take blood pressure as well. In order to be successful in taking blood pressure, one must understand it first and know what they are looking for. They must also know the materials needed to take blood pressure, as well as the procedure. Blood pressure is the force of blood as it moves through the circulatory system, and according to the American Heart Association, over 100 million people in America have high blood pressure. Blood pressure is written as systolic blood pressure over diastolic blood pressure. This is how it looks like. This is your systolic blood pressure, and this is your diastolic blood pressure. Your systolic blood pressure is the first number you listen for or you look for, and it is the top number. It is the pressure of blood as it moves through the artery walls per beat. Diastolic blood pressure is the bottom number and the second number that you look for. It is the pressure of blood as it moves through the artery walls while the heart rests per beat. A normal blood pressure would be 120/80. The materials you need to take blood pressure are a stethoscope, like this, pressure cuff with a pressure gauge, and here's your balloon to inflate it. You need a chair or table, and alcohol wipes are optional, but it should be noted that if you work in a facility or a hospital, then more than likely you're expected to clean your equipment before and after you use them. Okay. So what you want to do is you want to sit the person in a chair in a relaxed position, or yourself if you're taking your own blood pressure. You want to find your brachial artery with your 2 index fingers. Don't use your thumb because it has its own pulse and it will not be accurate. So you use your 2 fingers on your brachial artery, which should be right here, the bend of your elbow. Okay. Now, since you found that, I want to put this on. And as you see right here, it almost tells you where to put it on. So if you were taking blood pressure on your left arm, your brachial artery should be right below the arrow. If you're taking it on your right arm, the artery should be right below the arrow as well. I'm going to be taking it on my right arm. Okay. Put this on right here. You want to make sure it's about an inch above the bend of your elbow. So right here. Make sure it's pretty snug. Okay. This little part right here, you turn it clockwise to lock it or close it so that the air doesn't come out. And then you turn it counterclockwise when you want to release some air. At this point in time, I would have cleaned my earpieces with an alcohol wipe as well as this part. Okay, before I begin, it should be noted that you should not talk or eat when somebody is taking your blood pressure or when you are taking somebody else's blood pressure. So whenever I'm doing my blood pressure, I'm gonna inflate this to 180. This is how it looks like. I'm gonna inflate it all the way to 180, and then I'm gonna slowly release the air until I hear the first heartbeat, and that will be my systolic blood pressure. And then when I stop hearing the heartbeat, the number that it's at will be my diastolic blood pressure. Okay. I'm gonna place this in my ears. I'm gonna place this right where my artery should be. Right about here. And make sure your arm is at like your heart level. So about right here. Make sure this is closed. And hold this while you look at the gauge. Okay, inflating to 180. Okay, 120/76. Gonna remove the stethoscope from here at this point. After I take this off, I would have cleaned my stethoscope and the earpieces, put away my materials. Many people who go into the medical field, or even those who may need to take their own blood pressure, should know or may need to know how to do it correctly. It is important to know what blood pressure is and what a normal blood pressure looks like. To take blood pressure, it requires few steps and materials. Thank you.